Okay, students, today we will see about growth and development of children, which is chapter 2. And before starting our lesson, today's session of objects, tips, especially at the end of the lecture, you will be able to identify the measure of the importance of growth and development, define what is growth and development, and mention the principle of growth and development and a factor which affecting growth and development, and mention types of growth and development. So what is growth? Growth is a physiological increase in size through cell multiplication or differentiation, which start or begin from conception and continue throughout childhood and adolescence until maturation. Growth is mostly obviously seen in weight and head change occur during the first year of life, and as well as when defining of maturation. Maturation is changes that are due to genetic inheritance rather than life experience, illness, or injury. So, what is development? Development is increase in skill and maturation of organ and systems, which begin from conception up to death. Development means increase function, mean what a child can do, what a child can manipulate. So development which can be extending from conception up to death. So some principles of growth and development. The first principle of growth and development is orderly and sequentially. That means, for example, a child learns to crawl before they learn to walk. The first step for walking is crawling, which is orderly and sequentially. Growth and development is directional. So that means it can be cephalocaudal, from head to toes or leg, or proximal to distal, from central to terminals. For example, head control is followed by sittings, then crawling, and then walking, which is directional. The first steps is they can control their head, and then sitting. Then after sitting, they can practicing or crawling. After crawling, they can move, which is directional. The third principles of growth and development is unique for each children, which depends on individuals. We are not expecting all children can be walk at the same times. The fourth principle is interrelated. That means which is interrelated each others. Psychological development can be interrelated with cognitives. Central nervous systems can be interrelated with cognitive development. So the fifth principles become increasingly differentiated. For example, infant will react with their entire body to pain by crying or withdrawing. A child is able to localize the pain, can often identify its source, and may only withdraw the extremity experiences the pain. That means they can understand or they can appreciate what is a respondent or what is the reason for responding an activity. especially which depends on child growth and development. And development and growth become increasingly integrated and complex. A new skill are gained, more complex tasks are learned. For example, infant cooing is followed by babbling before the sounds are refined into understandable speech of a child. The seventh principle is child as competent. Both quality and ability ensuring their survival and promoting their development. For example, newborn can be cough, sneeze, suck, swallow, digest, breathe, and elicit caretaking response from adults. The last principle of growth and development, new skill predominate. For example, when children are learning to walk, talk, or feed themselves with utensils, their attention and effort is focused on developing the one skill. They do not usually learn to walk, talk, and feeding themselves at the same times. No new skill can be predominant. What is a factor which affecting growth and development? It can be classified broadly into two: genetic factors as well as environmental factors. Genetic factor, which is inheritance, they can genetically affecting the growth and development of children. The other is external factors, which is environmental factor. Environmental factor can be categorized into three: intrauterine factors, factor during delivery, factor which affecting growth and development after delivery. For example, perinatal factor which affecting growth and delivery is like nutrition, maternal nutrition, or infection of mother during pregnancy. Maybe a mother who took a drug during pregnancy that may affecting growth and development of children. During labors, especially lack of oxygen, like for example prolonged labors, asphyxia, which may affecting growth and development of children. And what is a postnatal, or a factor which affecting growth and development after delivery, or external environments which may affecting growth and development of children. For example, inadequate nutrition, unavailability of food, or family size, especially large family size, unable to provide adequate amount of food for all household levels. That means it may affecting child growth and development. This is a factor which may affecting growth and development. So next to principle and factors, what is stages of growth and development? Children's stage can be broadly classified into 4: infancy, early childhood, mid childhood, and late childhood. Under infancy, there is neonate as well as infancy. Neonates from birth to 28 days, and infancy is the age of newborns less than 1 year. Early childhood can be classified into 2: toddlers, which age is 1 to 3 years, preschool age 3 to 6 years. Middle childhood, school age, especially age 6 to 12 years. Maybe student can join primary level of education. Late adolescent, late childhood, especially age from 13 up to 18 years. So how to assess the development of children? So what is the developmental assessment? Developmental stage, it has 4 stages. First is gross motor development. That means gross motor development means gross muscular activity and neurological developments, which include posture, independent mobility, progress from head control to running. This is a growth. Fine motor development, which is grasping or manipulation of an objectives. Cognitive and social skills. For example, new or children can respond to sounds, watching mirrors, maybe waving goodbye, and so on. Psychosocial development, which including language development. So the first language of development is crying. So this is developmental assessment. And what is the common characteristics for each developmental stage or stages of development? We are assessing or observing based on the stages of development what activity or situation can be happens. As the first years of age, we can classify first years. That means we can classify into 0 to 2 months, 2 to 6 months, and 6 months to 12 years. We are expecting at the age of 0 to 2 months, we are expecting the normal weight gain or average weights after delivery, especially within the first weight of newborns. The normal weight is from 2,500 up to 4,000 kg, milligrams or grams. But what is the average term newborn weights, especially normal weights, 3.4 or 3,400 grams. Length, especially which is measured from vertex to sole of foot, which is 50 centimeter, as the normal range is from 46 up to 53 centimeters. The average is 50 centimeters. The average head circumference for normal newborn baby is 35 centimeters. So the normal head circumference from 33.5 up to 37 or 35.5 centimeter for term infant. At the age of 0 to 2 months, newborn can hold head steadily while sitting, especially after the age of 2 months, starting of social smile or responding to smiles, or maybe recognize the voice of his caretakers, maybe holding an object, and maybe the object can be drawn from hands with involuntary crying. For at least normal crying, a newborn can be crying for 3 hours per day. Maybe the amount or crying duration can be increased at the age of 6 months. And we are expecting that age from the first years of life, age from 2 to 6 months, then weight gain may be slow. That means 20 grams per day, maybe doubling of the weight of newborns at the age of 6 months, and pulling to sit with no head lagging, or maybe controlling the head is normal. Palmar grasping is gone at the age of 6 months. Palmar grasping means they can hold or grasp an object with palms or whole hands involuntarily. Maybe transferring objects from hand to hand at the age of 6 months. What is development or growth at the age of 6 or 12 months? A child able to sit without support at 6 months, maybe rolling back to our stomach, and maybe Prince grasping, maybe thumb finger grasping at age 9, which is fine motor development, maybe normal at the age of after 6 months. Especially thumb finger grasping is commonly appreciated at the age of 8 to 9 months. That means using their finger for holding some or picking something from soil or from walls or from selected objectives. So at the age of 6 to 12 months, tooth eruption occurs. Mandibular central incisor can be started at the lower jaw. Maybe saying mom or dad at the age of 8 to 10 months. Maybe uncover toys and walk alone at the age of 12 months. Speak few real words at the age of 10 months. Maybe they can pretend to drink from cup at 12 months. As second year of life, it can be classified into two: age from 12 up to 18 and 18 up to 24. Maybe appears that Jan virus or ball leg when they're starting to walk, because the weight of newborn is carried by female, and so that they can stand like ball legs, which is the lower extremity unable to carry the weight of newborns or children, so that the structure of legs can be ball legs. Walk alone and can be run at the age of 60 months. Walk up start with one hand holding the stage at the age of 18 months. At the age of 18 or 24 months, maybe height and weight increase. At 12 months, 24 months, or 2 years, child are able to have of their ultimate adult weight, height, and hair circumference, or 90% of age development or hair circumference development may be achieved at the age of 2 years. And speak to words or word statement like mom shoes, dad shoes at the age of 19 months. And what is the characteristics, or especially when we are assessing milestone development of children, especially age from year up to 2 years, especially gross motors. We are observing like child able to crawling at the age of 9 months, maybe standing independently at the age of 12 months, or walk alone at 13 months, and now running, they can run at the age of 50 months. And fine motors, that means manipulating or holding of an objectives, newborn very little controls, or maybe involuntarily drop an objective from their hands. Maybe as the 6 months of old, palmar grasp, that means they are using the entire hand to pick an objective from somewhere. Prince grasp, that they're using like thumb and forefinger for grasping small objective at the age of 9 months. What is the red flags? That means developmental delaying at these age groups. For example, at 9 months, unable to sit alone by themselves. It's not normal growth for children. Like unable to transferring objective hand to hand at the age of 1 year. This is abnormal development or delays of developmental delays. Or prince grasp by age of 50 months, which is not normal. Unable to walk alone at the age of 18, this is developmental delays. Failure to speak or recognize word by 2 years, this is developmental impairment or delays. Preschool age, especially age from 3 to 6 years, maybe somatic and brain growth slow down at the age of this one, so that nutrition requirement of children may be decreased, so that picky eating is common in these age groups. And all tiny primary teeth has been erupted by a series of age. Bowel and bladder control emerge during this period, especially at the age of 3 to 6, knowing age and sexes. Bed weighting is normal up to 4 years in girls and 5 years in boy. Language development more rapidly between 8 to 5 years of age, and they are characterized by magic thinking age. These ones, they are repeatedly asking what things happens, why at the age of 3 to 6 years. So help in dressing, especially at the age of 3 years, and copying of circles. They alone can use toilet at the age of 4 years. Drawing triangle, dressing and undressing, especially at the age of 5 years. Maybe as a rule of thumbs, between age of 2 to 5 years, the number of words in typical sentence equal to their age. Like by age of 2 years, they can talk or understand 2 words, age of 3 words, and so on. And at middle child's age, especially school age, from age 6 up to 11 years, growth during this period, average weight is 3 to 3.5 kilograms and 6 to 7 centimeters per year. Increment of age and weight can be happened. So loss of deciduous baby teeth and the more dramatical sign of maturation begin around 6 years of age. Fine motors at the age of 3 to 6 years, especially, or 6 to 12 years, writing skills improve. Fine motor will be more focused on building, sewing, musical instrument, painting, typing, and computering these age groups. Gross motor, we are expecting age from 8 to 10 years. Team sports they can practicing. And what's the red flags or developmental delaying of these age groups, especially 6 up to 12 years? School failures, lack of friends, social isolation, fighting, fire sitting, or animal abusing. This is developmental impairment or problems. When you go to adolescence, especially it is preceding crossing 3 distinct periods: early, middle, late adolescence. Early means age from 10 to 30, middle 14 up to 60, late adolescent age from 60 beyond 17 years. So early adolescent age from 10 to 30, reflecting the stage of puberty, and second sexual character maybe happens, begin rapid growth of body, especially like height and weight, maybe especially in girls, breastfeeding, but special growth of breast 8 to 12 years, menarche at the age of 12, picking head earlier than boys. In boys, testicular enlargement, penile growth is common. Middle adolescent at the age 14 up to 16 years, period of rapid growth of heads, followed by peak of weight after 6 months. Late adolescent, age from 17 up to 18 years, physical maturation gain, slow rate of growth. So nutritional requirement also maybe decrease. This is all about growth and development of children's. In summary, you know that it's better to assess what is growth, what is development, and the principal growth and development, and what's the factor which are affecting growth and development. Thank you. Stay home. Bye.